Hello, and thank you for the opportunity to present my research. This presentation is based on a piece of work from my PhD and will focus on the association of borderline personality traits and postpartum psychiatric outcomes. Why is this important? Because the postpartum period is a crucial time of the family life cycle. Women with bipolar disorder have approximately 40 to 50% chance of having an illness episode related to childbirth. And in 20% this will be severe, what we call postpartum psychosis. Therefore, knowing the factors associated with such outcomes will be beneficial for the prediction and prevention of episodes. Several factors have been studied, but personality disorder traits have not yet been a major focus of these studies, with only a few covering personality traits in general and none dealing with borderline personality disorder specifically. The aim of this study is to establish if borderline personality disorder traits are associated with postpartum psychiatric outcomes. We recruited participants as part of a large ongoing program of research, the BDRN, recruited from the NHS, media and patient support groups. We included participants with a lifetime DSM-4 diagnosis of bipolar and who were parous women. We interviewed them using a semi-structured interview, scan, and used case notes to collect relevant demographic and clinical information. To measure borderline personality disorder traits, we used the BEST questionnaire. This stands for Borderline Evaluation of Severity Over Time, a 15-item self-rated questionnaire originally developed to rate the degree of impairment from each of the 9 borderline personality disorder criteria. Each item is rated in a scale from 1 to 5, lowest to highest rating of severity, and the total scores of the version we used range from 12 to 60. We tested the association between BEST scores and perinatal psychiatric outcomes in 2 main ways. Firstly, we tested the association between BEST scores and overall perinatal recurrence using binary logistic regression. We then conducted multinomial logistic regression analysis with the different subtypes of perinatal psychiatric outcomes: postpartum psychosis, postpartum non-psychotic depression, and other perinatal episodes, compared with no relapse, and the BEST scores as a main exposure variable. All analyses were adjusted for pre-specified covariates. 807 women met the inclusion criteria and completed the BEST questionnaire. We found that there was no significant association between BEST scores and having a perinatal recurrence when all perinatal episodes were considered together. Interestingly, however, when we distinguished between different types of perinatal psychiatric episodes, we were able to find significant and relevant associations in opposite directions, as we can see in this figure. Women with higher BEST scores were significantly less likely to have experienced an episode of postpartum psychosis, but significantly more likely to have experienced an episode of non-psychotic postpartum depression. We can also illustrate this looking at the predicted probability of different perinatal psychiatric outcomes given a BEST total score. For postpartum psychosis, it decreases with an increase in a BEST total score, and it increases with postpartum depression. This is the first time that borderline personality disorder traits have been assessed in women with bipolar and in relation to psychiatric outcomes following childbirth. It adds to evidence that personality traits usually associated with bipolar were not associated with an increase in postpartum psychosis, over and above their impact on the underlying mood disorder. We know that perinatal period is a high-risk period for recurrence. We found that in women with bipolar, borderline traits differentiate the risk of postpartum depression and postpartum psychosis. This emphasizes the importance of considering risk factors for these perinatal episodes separately, and it may help individualize the risk for women in the perinatal period. Thank you very much to all our research participants, to our funders, and to my research group. I'm very happy to be contacted, and here are my details. I hope you've enjoyed. Thank you.